Now, in India's scenario, we can see that we have been using our ancient knowledge to cure mental health illnesses. So in 1600 BCE, the Charaka Samhita, they like documented conditions like Unmada, Vishada, which were like parallel to psychosis and depression. Then there were Ayurvedic traditions that offered treatment during this period. In the colonial era, we see the treatment focusing more on the asylums, and the British introduced the Indian Lunacy Act, which were a mirror to the asylums that were in the Great Britain at that time. And then post independence, we have been forging our own path. There was establishment of Nimhans Bangalore in 1954, which took initiatives like the National Mental Health Program, District Mental Health Program, to which aimed to decentralize and improve mental health care access. Then there was a shift in 2017 with the Mental Health Care Act. So here there are many like crucial provisions like advance directive, decriminalization of suicide attempts, ban on chaining, and giving an ECT without anesthesia. So despite this advancements, we still have more path to carry out, because in India, there is an estimated 150 to 200 million people who will be requiring mental health care, and there is a like treatment gap. Only 70 to 80% people are there who are not receiving, who need this care, and they are not receiving this care. And per 1 lakh population, we are having only 0.3 psychiatrists, whereas WHO recommends one psychiatrist for 1 lakh of population. So we have a long way to go. So the future of mental health nursing, we will see that there is digital mental health, which are nowadays offering like different apps are there, AI assisted screenings are there, that is taking place in whole of India. Then we have peers support workers, like these are the patients who have been cured of mental illnesses, and now they are working with the mental health team to provide or assist the patients. Then we have informed care. We are trying to learn that what is the role of trauma in mental illnesses, and how our uh, health system can be used to provide a better care. And we are also taking the spiritual side uh, and culture aspect in our nursing practices. We are like engaging with religious healers, we are engaging with family members, we are coming out with uh, cultural explanatory models to cure mental illnesses. Then with psychiatrist shortages, we are trying to increase the number of trained psychiatric nurses who will be leading in the community mental health delivery. And another thing which is important and we should be working towards it is mental health literacy, how we can reduce stigma, how like not only focus on the mental illnesses, but how we can improve the mental health of the people in schools, workplaces, and in communities. So a quick takeaway is that in earlier we were seeing that mental illnesses were considered to be some supernatural doing. Then we moved to asylums, then to community-based care, and now we are focusing on the recovery model. Then earlier treatment was mainly on chaining the patient, confining them. Then we move to the pharmacologic and psychotherapies. And now we are using more evidence-based care to the patient. Then in nursing, we have seen that earlier there were attendants who were not trained in how to handle psychiatric patients. Then came Florence Nightingale, who gave the environment theory, which was a basis for the psychiatric nursing, and Peplow gave the uh, therapeutic relationship model. And our modern nursing is focusing on mainly on the therapeutic nursing, assessment, pharmacology, and risk assessment. And in India, we move from the traditional methods of treating the patient to colonial asylums. And post independence, there was the establishment of the NIMHANS, and we got our first national mental health program in 1982. Then in 2017, we came up with a mental health act. And another thing that we should keep in mind that uh, 70 to 80% people till now do not receive proper mental health care when they are needing it. So there is a huge treatment gap. And for caring of any psychiatric patients, we should remember the five principles. That is, therapeutic relationship is fundamental. Mental illness is not moral failing, and patient rights are non-negotiable, and culture matters, and we should be more focusing more on the community for treatment of the psychiatric patients. So we have traced a journey from ancient beliefs to right-based community-focused mental health care. And so thank you for the session.